welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy talking about a bunch of plastic surgery procedures. This one is post-bariatric surgery.
Yes, so it's post-bariatric plastic surgery. It's a big group of procedures that we use after people lose a lot of weight.
Now, that's a huge surgery. A lot of people are getting bariatric surgery, correct? In different forms. And so this is a huge problem.
Yeah, since we have bariatric surgery, we're seeing hundreds of pounds of weight loss, which is something relatively new to plastic surgery. So the procedures are very similar to what we do for folks who haven't lost that much weight, but they're a little more involved because we have extra skin and more skin to deal with.
All right, let's go to picture number one. What's going on here?
So here's a lady basically had a mommy makeover.
Okay.
So she's had an augmentation with a lift, as well as a tummy tuck. And these are very common procedures for folks after weight loss because they lose volume, they have extra skin, both on their belly and their breast.
Okay.
And you see in the before picture, her belly is sticking out farther than her breast.
Right.
She would rather have it the other way.
Absolutely. The after picture is great. Now, is this a bigger surgery, obviously, because she had the bariatric surgery? Or
it's a little bigger surgery in that I'm responsible for more of the volume in the breast.
Gotcha.
So I have less of her breast tissue to try and disguise the fact that I did some work there.
Okay.
And usually the belly is stretched out more, both the muscle and the skin.
So it's a little...
There are some folks where we can't just go along the bottom. We actually make an extra scar running up and down the middle, called a fleur-de-lis tummy tuck, in order to get more of that skin out from side to side.
Gotcha. It's definitely worth it after the surgery, however. Picture number two.
So picture number two actually is a fleur-de-lis. I don't have the up and down scar where you can see it, but I will try and put that up. But you can see how much the skin hangs over.
Yeah, big
and that's just something you don't normally see with regular pregnancy or normal weight loss. It's pretty much only seen after massive weight loss.
And that's not a bad scar. I mean, it's a scar, but you know, these scars, same thing. They're gonna, are they bigger scars?
So this is a relatively new scar. It's red, and those fade with time.
Okay, good. Now, let's go to the next picture and talk about combining all these procedures. Can you combine a bunch of procedures after weight loss surgery? Or is it too risky?
Each of these procedures are pretty good sized procedures, so we can combine them, but it needs to be done reasonably.
Gotcha, okay.
And also I have to worry about how is the patient gonna recover? Where am I making them sore? How are they gonna get up? How can they take care of themselves?
Right.
So usually there's a little give and take. What I try to do is prioritize. So I'll listen to my patient. They tell me, you know, this area are the most important. We'll see if we can combine those and get that done for them.
Bothers them the most. All right, next picture.
So same idea, just a lot of laxity, and you can see the muscle laxity because there's that shadow that runs down between the O and the S there.
Yeah.
And the front has just a lot of projection because the muscle's been weakened. It's been stretched and pulled apart. We call it a diastasis.
Oh.
So often if these folks do a sit-up, instead of that flattening, it pooches out more because the muscle's not there. And then of course there's the obvious extra skin down at the bottom.
So you definitely did a tummy tuck with the pulling the muscles together and sewing them together.
Tightening up that muscle helps.
So we're talking time after the surgery just varies with what you've had done, correct? You know.
It does, and as I'm tightening the abdominal muscles, it does affect the core, so it does slow people down more.
That's a big one. All right, next picture, and we've got an email for you since we're doing the arm. Sarah from the East Bay wrote in and said she just had a procedure. She doesn't, you know, names a procedure, but anyway, she wanted to lose the bat wings under her arms. She had this procedure, and she seems to think she has more loose skin now. What's going on there?
Probably didn't have a surgical procedure because there's lots of other procedures that are done outpatient that I really wish worked. It would save me a lot of time than having to do all this, you know, knitting and sewing things back together. But often I will see people who've had less invasive stuff done. They'll get some improvement from it, but it's not enough.
But it's not going to fix our
and I think sometimes that helps them mentally because now they feel prepared. Okay, I know I need more.
That's true. That's true. I've done what I can do.
And we can offer more.
And
the downside is I leave a scar, whereas these other procedures do not. And if I could do it without the scar, I'd be very happy. But like this patient, there's just twice as much skin as there needs to be.
A lot of
There's no magic shrinking ray at this point in time that'll take care of that.
All right, our final picture, I wanted to get this because this is a total body lift.
Sure, so I've lifted the whole lower body. So it's kind of like a tummy tuck that goes all the way around.
Love that. And so it's like putting on pantyhose. Everything just kind of lifts up, right?
It's like pulling up the pants, pulling down the shirt, making it tight. It's the other name for it is a belt lipectomy, which basically means removing fat in a belt around the middle, which is essentially what we're doing.
Now that scar is not bad. Tell me the time after surgery.
These take longer to do.
Yeah.
Because I've got to go all the way around. Obviously, I can't do it in one position. I have to move the patient. And the most difficult part is trying to get that scar to be straight.
Yeah.
Because the skin is lax in different areas, and sometimes it ends up a little bit wavy. But I have to say, most of my patients really don't care about the scar because now they can fit in close.
And downtime for that whole body lift?
Similar to a tummy tuck.
Oh, really? Not bad.
The back doesn't tend to add a lot.
Oh, pantyhose, pull them all up. All right, thank you so much. For more information about Dr. Mealy, you can call his office, 925-943-6353, or check him out on the web at either drmealy.com or sanfranciscobreast.com. We'll be right back on Body Beautiful.